A lot of men suffer in silence because of body issues.
Maybe mostly 15 to 25 years, teenage group or a young age group, the people are suffering from gynecomastia.
Now talking of the most hot trending topic, which is liposuction and tummy tuck, which everybody wants to get it done for the right reasons or the wrong reasons.
See, the liposuction means fat removal. Lipo means fat and suction means we have to remove the extra amount of fat.
Now another thing which is very common is like body scars. So some people are born with it and some due to accidents or trauma. So how do we correct these body scars? Welcome to another exciting episode of Beyond the Mirror, where we cover some real stories based on confidence, transformation, and modern medicine. So today we have with ourselves Dr. Sahil Singla, who is one of the leading plastic surgeons practicing across Delhi NCR. He practices in Apollo, Gurgaon, Noida, and Elantis in South Delhi. So we are going to discuss a lot about gynecomastia, liposuction and tummy tucks. So stay tuned for the entire episode. Welcome Dr. Sahil Singla.
Hello ma'am. Yes.
So when we talk of plastic surgery, most of the people have this notion that it is all about, a celebrity look or changing your face completely. But that is just on the surface. So can you tell our viewers what plastic surgery actually means?
See ma'am, plastic surgery is basically a word derived from Greek word plastikos, and plastikos means to reconstruct or to reframe. So the plastic surgery is not only for the cosmetic procedures, it is a very wide branch. It covers all microsurgery, all face surgeries, all trauma, maxillofacial trauma, and there's a flap surgery. If you see the cancer patient, so in cancer patient, what we the oncosurgeon, we are working with oncosurgeon also. They are removing the part and we are building the part again. So the plastic surgery is not meant for cosmetic surgery. It is a wide field of surgeries basically. Yeah.
Okay. A lot of men suffer in silence because of body issues. So can you throw some light on this aspect, doctor?
See, the gynecomastia is basically enlargement of the male breast. So, in our young age group, maybe mostly 15 to 25 years, our teenage group or a young age group, the people are suffering from gynecomastia due to the hormonal imbalance. The most common hormonal imbalance are taking in this kind of age groups. Secondly, the people are doing gyms, and now in gyms they are taking lot of steroids for bodybuilding. And thirdly, if some person are taking some medications for any chronic disease, उससे भी हमारे glands, breast glands develop हो जाते हैं. And when the breast gland develop, then we have a problem like anxiety issues, कपड़े change करना किसी के सामने, the personality issues, people feel shy, people doesn't want to attend any parties, or in swimming pool में नहीं जा सकते. So there are a lot of psychosocial issues. So we are doing the gynecomastia surgery. We are doing the liposuction with gland removal. Once the surgery is done, the chest becomes flattened and people regain their confidence.
And how safe is this surgery, doctor?
The surgery is totally safe. We are doing on a daycare basis, means the patient is coming in the morning and by evening we'll discharge the patient, and the procedure is to be done under general anesthesia. And depending upon the grade also, if the patient is having only grade 1, then we can go under local anesthesia as well. But generally the procedure is to be done under GA only.
And what is the downtime of this surgery?
1 hour.
Okay.
Yes, 1 hour surgery, and recovery is 2 weeks. And once the surgery is done, we ask the patient to wear a pressure garment. एक pressure garment होता है like a jacket. So
Okay.
आपकी compress जो आपकी chest को compress करता है, उससे आपकी chest की shaping आती है ढंग से. तो वो pressure garment होता है.
Now talking of the most hot trending topic, which is liposuction and tummy tuck, which everybody wants to get it done for the right reasons or the wrong reasons. First, can you throw some light on liposuction and tummy tuck?
See, the liposuction means fat removal. Lipo means fat and suction means we have to remove the extra amount of fat. Now the patients are coming कि उनका weight बहुत ज़्यादा हो गया है, या हमारा टमी कम नहीं हो पा रहा है जिम से, एक्सरसाइज से, लाइफस्टाइल चेंज से, या किसी का स्टबन फैट होता है जो जाता ही नहीं है. यू सीन लाइक फीमेल्स आफ्टर डिलीवरी, उनका टमी जो है एकदम हैंगिंग हो जाता है, लूज हो जाता है, उसमें हम टमी टक भी करते हैं. एंड इन यंग एज ग्रुप normally liposuction is only sufficient. एंड उसमें जो हम फैट रिमूवल करते हैं उसमें एक्स्ट्रा अमाउंट ऑफ फैट जो हमारे लव हैंडल से, यानी कि साइड बल्जी से, या फ्रंट टमी से, या बैक से, या थाई से, किसी को आर्म्स पे भी जरूरत होती है, तो लाइपोसक्शन हम कहीं भी कर सकते हैं। तो इससे क्या होता है कि जो हमारे बॉडी का एक्स्ट्रा अमाउंट ऑफ फैट है वो चला जाता है। एंड ये एक वेट लॉस प्रोसीजर नहीं है, ये एक मिथ है कि सर हमारा वेट कितना कम हो जाएगा, हम बिल्कुल। और एक चीज और है, इसमें इंचेस लॉस ज्यादा होते हैं, एंड उसमें ग्रेजुअली द इंचेस लॉस अकर्स। एंड पेशेंट की जो एक्सपेक्टेशन होती है कि मेरा टमी बिल्कुल फ्लैट हो जाए, स्लिम हो जाएगा, बिल्कुल खत्म हो जाएगा, ऐसा डिपेंडिंग अपॉन द पेशेंट कितना वेट था पहले, क्या हाइट है, क्या उसको कुछ और तो नहीं था, उसके हिसाब से हम लोग पहले पूरा काउंसलिंग सेशन लेते हैं बिफोर द सर्जरी, एंड उसके अकॉर्डिंगली पेशेंट को पूरा बताते हैं कि ये आपका रिजल्ट आएगा, इतना आएगा, और ऐसे ऐसे हम करेंगे।
So how safe are these procedures and are they for everybody?
Yes, we can do at any age group, be it a young patient or a old patient, and it is very safe procedure if done by a board certified plastic surgeons. So we are doing the laser liposuction. We are taking the, we have having the laser machines also. And the difference between the laser and the normal liposuction is, laser there is a recovery time is faster, the pain is less, the tissue trauma is less as compared to normal suction. So in our practice we are doing the laser liposuction.
So now another thing which is very common is like body scars. So some people are born with it and some due to accidents or trauma. So how do we correct these body scars?
See, scars are mainly there are a lot of scars. Maybe it's a post-traumatic, किसी जलने के बाद scar हो सकता है, किसी को by birth हो सकता है, किसी को चोट लगने के बाद भी हो सकता है, किसी को पिंपल के बाद भी scar होते हैं. So depending upon the scar size and the location, we are doing the scar revision surgery. Every scar cannot be treated by scar fading gels. Have you heard about Mederma gels or some
Yeah.
skin fading gels? People are trying a lot, but they are not getting the results. So scar, we can treat scar by laser therapy and the surgical therapy. Sometimes we do the surgery first, followed by laser therapy. Sometimes people may require laser first. If laser doesn't work, then surgery. So ultimately, we are improving the scar width and the length.
So you mean to say, doctor, all types of scars can be removed by plastic surgery?
Yes, we can. Up to, I think 90% of scars can be removed.
So talking of another important topic that is very relevant when we talk of women is the breast augmentation. So some women want to have those implants, and there are some of them who want to kind of reduce the breast fat. So can you throw some light on this?
See, now in breast, we are doing three types of surgeries mainly. This first is breast augmentation, second is breast reduction, and third is breast lift. So breast augmentation means the woman desire to having a large size of breast. We are using either implants or a fat, patient body fat, or a implant, silicone implants we are using. Second is breast lift. In breast lifting surgery, we are you have seen like after deliveries or in your late 40 50s of age, a woman having a sagging breast. So although their size is optimum, but they want to have a good body look, and also in these kind of patients we are doing the breast lift surgery. Some patients we are seeing it on a daily basis about they having a chest pain, neck pain, shoulder pain, cervical, and they have a maybe itching over the lower part of the breast. So these women having a large breast, maybe more than 40 44 size, so they want to have a lower to get the reduce the breast size. So in this kind of patient we are performing the breast surgeries, so to decrease the size basically. So and apart from this we are dealing with axillary breast also. Have you seen like there is a mass coming in the axilla, armpit?
Yeah, yeah.
So these are most commonly after deliveries because of the hormone imbalance during the pregnancy. So they develop gradually over the some mass is coming underarms mein. That is known as axillary breast. It is painful also. Sometimes it is painful also. So we are doing this kind of surgeries as well.
And doctor, when we talk of silicone implants, so I've heard some weird stories about people getting cancer at later stages of their life when they go for this. So what is your take on that?
See, now there's a micro-textured implants coming, so the cancer chances is almost zero. Earlier we have generation 4, generation 3rd implant that also causes 1 to 2% chances of cancer. But now the silicone implant which is coming, they are the US FDA approved generation 5. So in these implants there is hardly any chances of cancer. It is almost zero.
And doctor, there's another surgery which is very common amongst celebrities and influencers, which is rhinoplasty. So some people get it done for the aesthetic look and some people get it done for the medical reasons. So can you throw some light on this?
See, rhinoplasties can be cosmetic and can be functional. So if the patient is having, किसी को चोट लग गया, trauma हो गया, nose पे road accidents हो गए, उसके बाद उसकी nose की deviation shape में nose की shape खराब हो जाती है, like कभी nostril deviated nose and deviated septums, किसी की bony इंजरी होती है, किसी की सॉफ्ट कार्टिलेज इंजरी होती है. सो इस चीज़ों में फंक्शनल इंप्रूवमेंट जरूरी है. किसी को डिफिकल्टी इन ब्रीदिंग भी होता है, तो इस केसेस में हम लोग सेप्टोप्लास्टी करते हैं. एंड अलॉन्ग विद किसी को टिप की जरूरत है, किसी को ऊपर से किसी की वाइड नोज है, किसी की क्रुक नोज है, तो उसमें हम एज डिपेंडिंग ऑन द पेशेंट condition, we are doing the tip plasty, we are doing for the dorsal rhinoplasty. And one more thing is coming now, it is a liquid rhinoplasty. Some patient just having a depressed part of the nose over the tip, and so we are using the fillers also for that is known as liquid rhinoplasty.
That's interesting. Yeah. And this is also completely safe? Yes,
this is completely safe. राइनोप्लास्टी ट्रेंडिंग मैंने अभी आपको बताया, जैसे फंक्शनल एंड कॉस्मेटिक राइनोप्लास्टी होती है, तो उसमें normally 2 to 3 hours surgery रहता है, डाउन टाइम एंड हीलिंग टाइम 2 to 3 weeks रहता है. एंड इट इज ऑल्सो सेफ, as I told you that these are procedures done by the board certified plastic surgeons, so all it is safe. We are doing safely in our clinics.
And when we talk of the cosmetic rhinoplasty, when people want to get it done to improve their looks, so in that case, how the patient can be assured of the final results, like what her or his nose is going to look like?
See, we are giving the patient 3D appearance in our pre-surgery counseling or in OPDs. We are asking them which part of the nose do you like the most, or do you want to get it correct. So, accordingly, we are giving the 3D views, 3D pictures to the patients. Like, it's not similar, but exactly almost similar. So, accordingly, we will guide the patients in the OPD itself. After once the patient is ready, then only after their proper consent, we are taking over the surgery.
Another thing which is again very relevant if I talk of, celebrities and influencers who are really getting it done is the buccal fat reduction. So how safe is that, and is it for everyone?
See, buccal fat reduction is for patients who are having a chubby cheeks. First is that, and the surgery is performed under local anesthesia mostly, and from inside of the mouth we are removing the buccal fat. Now this part of the fat of the cheek, this part is having a buccal fat, so the patients want कि मेरा ये वाला part मेरा थोड़ा सा कम हो जाए, right? बाकी face को, there is nothing to do with buccal fat. Only this part of the face gets slim. So it hardly is a half an hour procedure. It is a day care procedure, and we are doing on the daily basis, and patient is happy after maybe 3 to 4 weeks when the swelling is gone.
Another very interesting topic, and which is very prevalent among males, is the hair transplant. So can you throw some light on the hair transplant, how safe it is and who all can get it done?
This is a very interesting topic, and it is a very these days very common also. So hair transplants, basically in these kind of patient who's having a endogenetic alopecia or having a family history, or despite of all the PRP, GFC therapies, and all the gel or minoxidil or something like that, and they are not getting the results. So in these kind of, we are doing the DHI now. There are two techniques normally we are doing, FUE and DHI. So these days DHI is more commonly performed. So it's a safe technique. It's if done by experienced surgeons. So it's basically a day care procedure, again 4 to 5 hour job, and depending upon the graft, and the patient requirement, कितना चाहिए उसको area cover करना. Normally there are type 1 to type 7 types of the alopecia. So normally type 7 require 2 sittings 6 months apart. Mostly up to type 5 we are doing a single sitting, but for type 6 and type 7 we are doing the double sitting, means the staging. So in this में क्या होता है कि पहले हम ट्रांसप्लांट करते हैं, उसके बाद फिर हम पेशेंट को फिर से PRP GFC थेरेपी एंटीऑक्सीडेंट थेरेपी पे डाल देते हैं, एंड उसके बाद फिर 6 months के बाद फिर पेशेंट को बुलाया जाता है एंड सेकंड सिटिंग परफॉर्म होती है. So it's a safe technique. Yeah.
So doctor, there's another important thing that I wanted to discuss with you, which is skin grafting. Now if you talk of the diabetic foot, or post burn. So in those cases, skin grafting is really helpful. Can you tell our viewers about this?
See, diabetic foot is the condition. A patient having a long-standing diabetes and the sensation of the foot is almost lost. So if there any trauma, so there will be a wound, and this wound is not going to heal.
Heal.
So patients are coming to us that having a history of 2 to 3 months कि सर डॉक्टर साहब हमारे यहाँ घाव हो गया है, वो ठीक नहीं हो रहा है, भर नहीं रहा है, हमने बहुत इलाज करा लिया. So उसमें हम हो सकता है डायबिटिक फुट में बेसिकली क्या है कि ड्यू टू द पेशेंट शुगर एंड द न्यूरोपैथी पेशेंट का वूंड जो है भर नहीं पाता. तो उसमें हमें पहले रूल आउट करना होता है कि एक्सरे अंडरलाइंग बोन ठीक है कि नहीं. अकॉर्डिंगली वी हैव टू एक्ट. एंड उस केस में पहले हम पूरा डिब्राइडमेंट यानी कि पूरे वूंड की क्लीनिंग करने के बाद उसमें ग्राफ्टिंग करते हैं. ग्राफ्टिंग बेसिकली क्या होता है, हम पेशेंट की बॉडी थाई से या आर्म से स्किन लेके एंड वहाँ पे प्लेस करते हैं जहाँ पे उसका वूंड हील नहीं हो रहा होता, जैसे फुट हो गया. एंड नॉट ओनली डायबिटिक फुट, वी आर डूइंग इन अदर काइंड ऑफ ट्रॉमा ऑल्सो. या आपने कभी देखा होगा कि किसी को चोट लगने के बाद ऊपर स्किन लॉस हो जाती है, उन केस में भी ग्राफ्टिंग करते हैं. एंड इनफैक्ट किसी पेशेंट का अगर बहुत बड़ा निशान है, स्कार है, कोई बहुत बड़ा मोल्स है फेस पे या नीवस है, जॉइंट नीवस जिसको बोलते हैं, तो उसमें भी हम ग्राफ्ट करते हैं.
So these graft are very successful. How's the
Yes,
success rate?
success rate is almost 100% depending upon the patient का पहले ब्लड शुगर लेवल और वूंड की कंडीशन क्या है, ये सब देख के ही हम ग्राफ्ट करते हैं. Yes.
Now, talking of a topic which is taboo in our society, when we talk of, vagina, after delivery, it tends to become loose. So, talking of vaginoplasty, which is a very relevant topic for women. So, can you throw some light on it? How safe is this procedure and who all can get it done?
See, vaginoplasty is a very safe procedure, and mostly we are doing post delivery patients, right? So vaginal gets loose, and some people are having a difficulty afterwards also. So we are doing surgical as well and non-surgical as well. So surgical vaginoplasty is I think is better to get it done because we are tightening the vaginal muscles. And non-surgical we are doing just a laser, and the tightness is not as much as we are achieving with by the surgical one. So it is a hardly a half an hour job, and it is a day care procedure, and patients can go home same day. And I think if like it's a very cost effective procedure also, it's not very costly also, and the people
Any post-operative care for that?
Post-operative care means like we are giving the vaginal washes and antibiotics and painkillers that patient has to take for 7 to 10 days. That's it.
Now, talking of another very interesting topic, and which most of the women like to go for, like a facelift. Whether we talk of celebrities or normal people, everybody wants to look good and young all the time. So facelift is really so common amongst everybody. So can you tell us the do's and don'ts of facelift?
See, facelift is most commonly performed after 50 years of age, and facelift is of upper facelift we can do, mid facelift and lower facelift, including neck. So facelift, surgical facelift, it's around 2 to 3 hours procedure, and depending upon the which part of the face we are doing it, upper facelift or mid or lower. So there is a scar mark. We are doing at the front of the ears, the scar goes like this. Okay. Whereas in non-surgical, we are just a thread lift. We are putting the needles and the threads, and we are lifting the facial tissues. Right. Yeah.
Now, when we talk of scars, acne is very prevalent when we talk of teenagers or, young individuals, even at later stage, because of, hormonal changes, people get a lot of acne scars. Yeah. So can they be removed with plastic surgery?
Yeah. Now, the acne is a very common problem in teenage group. People are, having anxiety issues. They are not going to school or colleges or parties. So basically, we have to treat acne first by the medicines. And normally, if you can see, there is a grade called nodulocystic acne. So in these kind of patients, there is the acne scars over the face, and there is the आपने देखा होगा कि खड्डे खड्डे हो जाते हैं फेस पे.
Right.
किसी खड्डे हो जाते हैं, लेकिन स्कार्स हो जाते हैं. So उसमें हम क्या करते हैं, फैट ग्राफ्टिंग करते हैं. एज ए प्लास्टिक सर्जन वी आर डूइंग द फैट ग्राफ्टिंग. उसमें जो हम फैट ग्राफ्टिंग कर रहे हैं, तो वो वी आर फिलिंग अप द गैप्स अंडर द स्किन. सो उससे मैं ये नहीं कह रहा कि आपके जितने भी स्कार्स हैं वो खत्म हो जाएंगे बिल्कुल, यानी कि बिल्कुल खत्म ही हो जाएंगे, दिखेंगे नहीं. कुछ हद तक कम हो जाते हैं, अराउंड 50-60%. उसके बाद हम फ्रैक्शनल CO2 लेजर कर सकते हैं, या कुछ और केमिकल पील या PC क्रॉस पील आती हैं आजकल, वो भी हम ट्राई करते हैं. उससे पेशेंट को काफी हद तक रिलीफ मिल जाता है. So in these kind of patient we are doing fat grafting.
That's very interesting to know
Yeah.
because it can just change, the.
Yes. In fact, fat grafting we are using not only for acne scars, we are doing for depressed scars also.
Okay.
किसी को आपने देखा होगा कि यहाँ पे माथे पे, फोरहेड पे या
हाँ.
चीक्स पे कुछ डिप्रेशन हो गया है आफ्टर
Right.
ट्रॉमा, तो हम उसको फिल करते हैं फैट से.
When you spoke about this, something came to my mind. A lot of people even get, the dimples done,
Yes,
who
yes.
do not have it
Yes.
naturally, So I hear a lot of celebrities getting it done. So how is that possible, doctor?
See, the dimple plasty is a very, I think, interesting procedure and my favorite one also. So people are coming to us कि मुझे बस एक साइड का डिम्पल चाहिए या दोनों साइड. We can do on single side and both side also. So from inside of the mouth we are creating a artificial dimple and that is very natural. Only in starting क्या होता है, there will be a static, यानी कि dimple हमेशा रहता है. Once after 2 to 3 weeks, dimple only occurs on the smile.
Okay.
So it looks very natural. Yeah.
And now another topic that is very relevant is the lipomas. So,
Yeah.
so with the plastic surgery that can be removed. So can you throw some light on that?
See, lipomas, they are a very fatty tumors. आजकल बहुत कॉमन हो गया है कि जिम में, बॉडी बिल्डर्स में दे आर लिफ्टिंग हैवी वेट्स. किसी की फैमिली हिस्ट्री होती है, आपने देखा होगा गांठें जगह जगह हाथों में, पेट पे, पीठ पे, थाइस पे. वो लाइपोमास नॉर्मली होते हैं, दे आर नॉन कैंसरस, दे आर नॉट कैंसर अनलेस अनटिल कि उसकी बहुत रैपिड ग्रोथ ऑफ साइज या इंक्रीज हो जाए साइज में और सडनली देयर इज अ पेन एंड ऑल. सो मे बी 1 to 2% केसेस में कैंसर हो सकता है. दैट इज वेरी वेरी रेयर. नॉर्मली दे आर नॉन कैंसरस. ओके. So we are removing by the hole and puncture technique. Okay. We are, for the large lipoma, we are giving a small puncture hole, and from that hole we are removing the large lipoma by breaking the lipoma into smaller pieces. Okay. And we are removing lipomas via small holes. So in fact we are doing liposuction as well over the back for tummy area. We are doing liposuction also. So it can be removed by the hole and puncture technique. It can be removed through via liposuction.
Okay, doctor, now when we talk of lipomas or many other surgeries, they can also be performed by, the general surgeons. So why one should opt for a plastic surgeon and not a general surgeon?
See, for all cosmetic procedures, we are doing almost all because we are trained in that field also. And for general surgery cases, either general surgeon or plastic surgeon are treating both lipomas also. But the thing is, I think we are more fond of scars, कि patient का scar कम से कम आना चाहिए and बिल्कुल light होना चाहिए. So I think we are doing our job very sincerely in that kind of field also. Yeah.
Okay, doctor, now let's do a rapid fire where you will give one-liners for the questions that I ask you. So one treatment that you love to do.
Liposuction.
One story which is very close to your heart.
It's a very difficult question to ask. In what sense you are asking?
One story, anything that touched your heart, or story, like some patient got treated by you and he or she had an emotional reaction to the results, what they saw.
Let me tell you one incident. There was a one patient who was having a diabetic foot. He went to many surgeons and ultimately he got an answer that we will cut your foot. So he came to me around 2 years back. So we have worked on his foot thoroughly. We have, there are a lot of dressings and all, debridements and all. Finally, we have saved his foot. So that was truly heart touching. And I remember his emotions after once his foot was saved. He was walking on in coming and greeting to me. That was very heart touching.
That's so good to know.
Yeah.
Okay. Botox or fillers?
Botox, because people opting for Botox more because of wrinkling and the forehead lines that आपने देखा होगा, crow feet, or some lines over the chin marks, or for the jaw line के लिए. तो उसके लिए हम Botox use कर रहे हैं. The result is good. It lasts for 6 to 9 months. And people get rid of the wrinkles and the facial appearance is good after that.
Now we'll ask you, doctor, the approximate cost of these procedures. Okay. Gynecomastia.
See, gynecomastia, depending upon the grade, we starting from 35,000. It goes up to 75,000. For liposuction again, for tummy, for front tummy only, or for back tummy only. For front tummy, we're starting from 75,000. For back tummy again, depending upon the area involved. And for thighs, we are charging 1 lakh. And that is rough idea, maybe more or less. So approximate all the cosmetic surgery procedures are well within reach.
Okay.
Yeah.
How about vaginoplasty?
Vaginoplasty is also around 40-50,000 bucks. So I think it's very cost effective procedure and it's very good. Yeah.
And why should one go for liposuction only from a plastic surgeon?
Uh, see, sir, because the plastic surgeon, they are trained under that kind of field first, and they are board certified. Means we have a training properly from Indian Association of Aesthetic Plastic Surgery, and we are doing on a regular basis, and we are doing the laser technique. We're trained in that. So I think that is the most common reason that plastic surgeons are doing mostly liposuction.
HIFU or micro needling?
HIFU is for skin tightening, so I think it's a better and my favorite procedure also. And it's like a non-surgical basically. In the neck lifts we are doing it, in sometimes and some other lifts, some other kind of tightening or face lift we can use HIFU. Yeah,
Hair transplant or PRP?
I think hair transfer is better as a surgeon. PRP is we are using it, but after only for after once we have done the transplant, or maybe if the patient is having a very patchy loss, so we can try PRP or GFC. Right now we are doing GFCs, not PRPs. Yeah.
That was such a deep insight into the world of plastic surgery. I'm sure you all must be excited and you've gained so much knowledge about the facts of plastic surgery, the do's and the don'ts. So, if you like this episode, please subscribe to my channel. Do like, comment, and share. Thank you.
Thank you.